Meeting is
community.
being recorded.
It has the potential, and we've seen this in other places and as well as here, to impact Black and Brown and Indigenous and people of color more severely for a number of reasons, because of underlying health conditions, and a variety of things. And while that pandemic, COVID-19, is impacting Black, Indigenous, and people of color more, so is the pandemic of racism that results in chronic stress and less access to healthcare and more interactions with law enforcement. So while I very much want to acknowledge and respect and show solidarity for folks protesting, I also would like to share some tips and to keep yourself safe. So as you can, and please encourage folks to wear their face coverings while they're protesting, to, as much as possible, maintain 6 feet of distance from other people, to wash your hands frequently or bring sanitizer with you. And we've seen in other places that where different people from different households come together, the risk for COVID transmission increases. So as you're coming back from protests, and if you live with other people, please wash your hands frequently, disinfect or wipe down shared surfaces such as faucets and tables, doorknobs. As much as you can, please avoid older adults and other vulnerable people. And we're asking that folks watch their symptoms for the next few weeks. It's too early to tell what sort of impact locally that the protests will have on COVID-19, but we're asking people just to be very mindful of symptoms. And if you develop a fever or shortness of breath or any of those symptoms, please reach out and get tested. So once again, I want to show solidarity in protest and sticking up for Black lives, and ultimately to address racism, to acknowledge that it's been enough. And I don't want to lose any more lives unnecessarily, Black, Indigenous, people of color, and or our allies that are marching. So with that, I'll turn it over to Chair Deborah Kafoury.
Thank you, Rachel. Good evening. I first want to echo the continued calls from numerous community leaders for both protesters and law enforcement to refrain from violence tonight and to remain peaceful amid this incredibly tense moment in our community and across the country. The overwhelming majority of protesters show up to speak the truth, to express their anger, and to grieve. More importantly, they seek to hold accountable racist individuals and systems that impede our progress towards a just society. We must acknowledge the injustices that have driven thousands of people onto the streets in protest. These systems disproportionately hold back, harm, and kill Black people. As the county government and as the local public health authority, Multnomah County has a profound responsibility to care for, serve, and partner with our community. Historically, the county has fallen short of listening to and responding to the needs of communities of color, especially Black Oregonians. But we are identifying where we must do better and in putting in the work to act more equitably. A key part of the county's work around preparing to reopen has been to address the health disparities that are a direct result of institutional and historical racism. So in addition to the state's prerequisites, the county created criteria and a response plan centered on Black, Indigenous, and other people of color. Our reopening and recovery cannot, and it must not, leave behind communities of color, so we will continue to be intentional about supporting their physical and economic well-being. This work reflects Multnomah County's approach to public health. It's how the health department looks at data to understand chronic disease patterns, and how the department analyzes the many years of life lost to Black people due to chronic conditions. It's why we look at strategies not just about tobacco use, but also to reduce flavored tobacco that is marketed specifically to Black kids in Black neighborhoods. It's why we have maternal and child health programs based on the strengths of young Black families. It's why our board explicitly leads its policy work with race, because at Multnomah County, Black lives matter. Our plans for reopening Multnomah County are robust and detailed, and we still do expect to submit our proposal for reopening on June 5th. That will give us time to track our case counts, and as we near our proposed June 12th reopening, we will reevaluate that timeline as needed.
Thank you, Chair. And now I think we can open it up for questions. You can chat questions. Kate and I are on the phone, and you can also raise your hand. And we also have Dr. Vines on hand to answer any of your public health queries.
This is Mila. Had a question. What are your concerns regarding reopening, and how flexible is your timeline to reopen once you get your application in?
Can you repeat the first part of that question, please?
Sure. What are your concerns regarding reopening, and how flexible is your timeline to reopen once you submit your application?
We are concerned. We're nervous. We really don't want to be reopening to benefit some at the expense of others. And I think if we saw a big spike in the number of people who had contracted COVID-19, or especially if they ended up hospitalized, that would be a sign to us. I think that we would much rather slow our reopening plan than to reopen and have to close back down. I think we've heard loud and clear from our public health professionals, from our community members, and from our businesses that having to close down again would be even more detrimental to our community. So I believe that we have taken things slowly, cautiously, and thoughtfully to reopen with a plan that will make sure that people in our community are safe and will feel safe.
Thank you, Chair. And I would say folks who are joining us should be able to unmute themselves and ask your question if you would prefer. But you can certainly chat us. You can also text us if you're on the phone at 503-410-4524.
This is Rachael Monahan. Can I ask a question?
Of course.
We're talking about you talked about the disparate impact that COVID-19 is having on communities of color, and the largest outbreak that I'm aware of that impacts communities of color is the Townsend Farm outbreak. What I don't understand at this point is the county's involvement with that, but I am curious if you could answer what steps are being taken to make sure that workers there who have been diagnosed are socially distancing from workers who tested negative, and what else, like they clearly traveled together here, like is there a follow-up with those workers? Like that seems to be like the heart of the issue of tending to a community of color right now. So could you speak to what the county is doing on that and those issues that I asked about?
Sure. Rachael, do you want to answer some of this? I know that
I saw that Dr. Vines had unmuted her phone, so I was Thinking maybe, okay. Sure. So thank you for the question and clearly for the care in terms of communities of color. So we have been working with Townsend Farms to do a number of things to clearly ensure folks were tested as well as had have access to places to socially distant. We're glad that nobody was seriously ill in that outbreak, but have been working with the employer to do a number of things to modify operations to make sure that the work site allows for social distancing, that there's increased hand washing availability, and ultimately that folks are able to comply with our recommendations to isolate and until they can get better. Dr. Vines, is there anything you'd like to add?
Thanks. This is, for the record, Dr. Jennifer Vines, the Multnomah County Health Officer. I would just add that the Townsend Farm outbreaks highlights how many communities of color are essential workers. They are on the front lines. They have no option to stay home from work. And so this is an example of why we've been cautious and really careful in our planning around reopening and really have done our best to put Black, Indigenous, and people of color at the center of our reopening plans.
I'd also add that we've been working with community health workers and community-based organizations who know the communities well and who have experience working with farm workers and to make sure that people have access to the needed care that they have access to information and education in a way that they can understand it, and to support those community health workers and community-based organizations to support our essential workers.
Do you know how many of the workers would have potentially been exposed to, like, were in, you know, they were under other circumstances you would maybe recommend a 14-day quarantine? Is it all of them? Do you know, isn't that the guidance that if you're like, you know, if you're in contact with someone who tests positive, you're still supposed to quarantine for 14 days, or has that shifted? And
yeah,
how many workers are impacted there?
Yeah, this is Jennifer Vines. I don't have the exact number at my fingertips. We didn't prepare this particular availability to be specific to Townsend Farms, but you're right that people in close contact have gotten health education through community health workers around their risk, around what to watch for, with an ask to stay away or minimize their contact with others for at least the next 14 days. And I expect we'll be continuing to have contact with Townsend Farms in the days and weeks ahead. So we'll continue to be doing our education, potentially identifying new cases, and going from there.
I wanted to go back to the potential June 12th reopening. I mean, how realistic is it that Multnomah County, can reopen June 12th, especially since the protests are still continuing? They don't seem to slow down. And it takes about 5 to 14 days for some people to show symptoms of coronavirus. Seeing that you guys will continue to submit that application, I mean, is that realistic?
There are risks inherent in at any time for us to submit our application for reopening. We know that families, individuals have been harmed by being cooped up for 2 months without access to their friends and beloved family members, without access to their jobs, without access to the economic viability that they need to survive. And that has put in an undue amount of stress on families. We believe, and we will submit our application when we believe that we have put in place a strong system for community testing and contact tracing, and a strong plan to support our BIPOC community members who we've seen have been disproportionately affected by this virus. There's not really going to be the optimal time. We have to weigh all of the myriad pros and cons that come with a reopening, and know that there's no crystal ball that we can look into and say, now is the time, go for it. We've done, I think, a very thorough and thoughtful job of being slow to this. We also know that despite our best efforts, people are going to go out in the community and socialize and be in groups. And we've seen that despite an 8 p.m. curfew, we had 4,000 people apparently on the streets of downtown Portland last night. So we can't force people to be inside forever. We need to put the precautions in place that we have. We need to give the public health advice about wearing face coverings in public, maintaining 6 feet of physical distancing, and washing your hands with warm soap and water as frequently as possible.
Thank you, Chair. We had a question from Elizabeth Hayes at the Portland Business Journal asking for more information on the specific measures that the county is taking to protect communities of color, specifically in their reopening plans.
Rachel, do you want to talk a little bit about our most amazing community-led BIPOC plan?
Yeah, absolutely. It's my pleasure. So we have, over the course of this pandemic and before, worked with community-based organizations, Black, Indigenous, and other people of color to listen to understand what their concerns were, what their needs were, and have a Black, Indigenous, people of color reopening framework. And what that does is it takes the governor's criteria and prerequisites and talks about the steps that we will take to protect our BIPOC communities. Some of those are things that we have done already, like adding additional metrics to our reopening dashboard and to our analysis of when we're ready to reopen. So for example, we have added, we also need to see a decrease in BIPOC hospitalizations as part of the reopening criteria. We have done things like, of course, gather disaggregated race and ethnicity data that we're updating regularly and looking at regularly. We've been in many conversations with community-based organizations to ensure that they have the personal protective equipment that's needed to serve their communities. In our distribution, we've prioritized those BIPOC serving entities, as well as those who work with elders and other vulnerable populations, for example, in congregate care settings, to make sure that those are the first prioritized for distribution of personal protective equipment. We are working to stand up community-based testing. We know that technically we meet that criteria, but our communities are telling us they want to see different testing across the county geographically, as well as some culturally specific venues. So we're working with trusted community-based organizations, faith organizations to stand up that community testing. So those are a few of the things that we're doing, but in each area of each criteria, we've added additional strategies to our plan to make sure that that BIPOC communities are protected. So we have heard over and over again that there's concerns because of their proximity as essential workers and the types of service and other jobs that people do, that there's concerns and that we need to pay attention to those before we're ready to reopen. And that's precisely why Multnomah County is the last to submit its plan, because we took those things to heart and we said, we're not going to reopen until we can make it as safe as possible for everyone in our community.
Hi, I have a question, Haley at KPTV. So to be clear, do you still plan to hopefully start the reopening process on the 12th, or your kind of things are up in the air right now with submitting an application?
At this point, we are still planning if after our presentation on Wednesday to the board, looking at the dashboard, looking at our plans and seeing where we are in the development or in the execution of those plans, we will submit our proposal on Friday, June the 5th for a proposed reopening on Friday, June the 12th. That's our plan. As we've seen throughout this pandemic, the best laid plans can go out the window if we see something that we are not comfortable doing. We have been very thoughtful and cautious throughout this pandemic to ensure, to the extent possible, that our community members are as safe as possible. And while we think the plan that we've put in place is thoughtful and thorough and puts our BIPOC community members first, we know that one thing we've learned through this pandemic is that you can't predict what's coming next.
This is Molly Harbarger with the Oregonian, and to go back to the protests, are you able to kind of make a general quantification of how risky it is for people to be going out and protesting? Like, for instance, if like last night, there's thousands of people, almost everyone was wearing masks, but there's thousands of people close together. Is that really risky? Is it because we're outside not as risky? Can you kind of expand a little bit on how much risk people are taking going out?
Yeah, so this is Jennifer Vines. I can take a stab at that question. It's a good one. I haven't done any kind of math or modeling. I would say that the stay-at-home orders have been really quite effective at keeping this virus at bay in our community. So I have good reason to believe that overall levels of virus in our community are low. That said, mass gatherings like the kind we're seeing were one of the first things that public health asked people to refrain from, knowing that people mixing closely in large groups is a very effective way of spreading this virus, especially if there's coughing, if there's secretions involved, as we know there have been. So I don't have a quantitative answer for you, except to say there is some, as with anything, there is some risk, and the larger the group, the closer the mixing, the fewer the precautions in place, like face coverings and the 6-foot distance and hand hygiene, then the more likely we will see viral transmission.
And to follow up on the coughing, quite a few people have ingested some tear gas during this. Do you have a sense of if that is increasing your risk because it is kind of getting in your lungs and that kind of thing?
This is Jennifer Vines again. I don't have hard science. I would say, anything that irritates the upper airway is not going to be helpful. I'm definitely concerned at anybody coughing in close proximity to others as just a potential way of getting the virus from one person to another.
Okay, if anybody, any last questions before we let folks go about their evening? Right. Thank you all for joining us this evening. Stay well.